I've been doing laser therapy for 10 years now, and my success rate, I'm so happy, is in the high 90s. I mean, I would say out of the patients that I treat, 99% of my patients have exceptional results. So when we're talking about gum disease and periodontal disease, and we measure that by taking an instrument called a dental probe. It's like a dental ruler, and we go in and we measure down into the pockets, and that gives us an idea of how extensive the bone loss or the tissue loss is. So typically the patients that I get referred to treat this disease are patients who would have anywhere between 5 and 6 millimeter pockets all the way up to 10 to 15. So normally when the gums are healthy around a tooth, you can probe a little bit around the gums and you get 3s and 4s, which are healthy, relatively healthy numbers. But when the pockets open up and the probings go deep and you're getting a 5 to 6 or something like this, a 10 or a 12 millimeter pocket, it's pretty advanced. So all of my successes are when I take patients from pockets like this to very, very shallow areas where they can maintain their own mouth because they can floss and brush and use all these little devices that clean between the teeth and keep their mouth healthy. Probably the greatest story that I have, which makes me so proud, is I had a civilian, he was in his 60s and he needed to be deployed abroad for some military work, and he had to get his medical checkup. And there is a marker of inflammation called a C-reactive protein, and his marker was extraordinarily high, and they wouldn't release him to go abroad. And so they said, we've got to do a liver test, we've got to check your kidneys, we've got to check your lungs, or something that's triggering this C-reactive protein to be so high. And they found nothing medically. All of his cardiac tests, his respiratory, his kidney enzymes, all of his medical tests were all normal. But his dentist found that he had an abscess on a tooth, and so the dentist referred him to me. He didn't have just one abscess, he had 5 dental abscesses and significant advanced periodontal disease. And so we treated him full mouth with laser therapy, and within 3 months, because he had to be deployed for this military work that he was doing, and he went back to his physician, and the physician re-ran his blood work and said, oh my God, you're incredibly healthy, you're a specimen of healthy, what changed your life? And he said, I had advanced gum disease that I didn't know that I had. And my periodontist treated me with laser therapy, and not only do I get to keep my teeth, but I'm healthier than I've ever been. And I get weepy because I'm saving lives. It's really exciting to see what we can do by removing the infection in the mouth, because it doesn't stay in the mouth. It gets in our bloodstream, and we know based on the literature and the research that it absolutely has a direct association with folks who are diabetic. It can completely skew your diabetic numbers, with cardiovascular disease, with respiratory disease. And the most recent news report is they're finding in, unfortunately, patients who've had Alzheimer's disease and they've passed away, and on autopsy, they're finding the same very aggressive bacteria that you only find in gum disease in the brains of Alzheimer patients. So there's a very strong association now with individuals with gum disease and Alzheimer's, as well as cancer and a host of other medical problems. So the mouth really is the window to the body. And if you can clean up the mouth, you can just create a state of health and wellness throughout the rest of your body.